I wish women knew that they had a voice, and I wish they knew that they can seek help because so many women suffer in silence. We're always giving of ourselves, right? We're always nurturing others, taking care of others first. And women will wait until things get so bad that they feel helpless, like there's nothing else they can do. And I wish that they knew that they don't have to suffer.
Hi, today's guest is someone who doesn't just look at labs, she listens to the body's story. You know how some people walk into a room and you just instantly feel calmer? Well, that is Rachael Wojcik. She is a board certified nurse practitioner and functional medicine practitioner who helps women get to the root of hormone imbalances, metabolism, gut health, and aging with grace. What makes her special isn't just her expertise. As you can see, Rachael has a really beautiful presence, and she truly sees her patients. She hears them and guides them with so much care. Rachael blends science with compassion, inner healing, and outer confidence. And today we're going to talk about what it really looks like to restore balance in the body and feel like yourself again. So, Rachael, welcome. I'm so excited that you're here.
Thank you so much for having me, Denise. I'm just so excited to be your guest today on your podcast.
Thank you. It's great. So, tell me, let's start with why do you do what you do?
Well, I have always had a deep passion for helping people. And when I decided to get into the medical field, I wasn't quite sure exactly what that purpose was at first. But as I started working with women in midlife, and my background is in aesthetic dermatology, I noticed that there was a shift in how the body was behaving and in the process of menopause and perimenopause dramatically affected the outcomes that I was seeing in my practice. And I decided that this was a calling I felt really connected to, not only because I was entering that next phase of my life, but I knew that my patients were coming to me with questions, and I really wanted to have a foundational support to help guide them, not just on their appearance, but also what was going on inside their bodies. And so when I began this journey into uh, as a family nurse practitioner into both functional and integrative medicine, I started to learn more about that connection between the skin and how the skin behaves. Because as you know, that's kind of how we first started to get to know each other as we had discussion about skin health. And
Perfect.
there's so much we can learn about the body just by looking at someone's face and their the way that their skin tells the story about their internal health. And so once we start to have that conversation of why are these changes happening, then we realize there's so much more to it than just the outward appearance of the aging process. So my why was really trying to get to the root cause of what's causing all of the pathologic conditions that happen in midlife and beyond. And then realizing that if we don't start interventions early on, we won't be able to catch up by the time these conditions start to occur. And so it's so important to get the conversation going about how we can prevent these health inequities early on in women's life and really educate them so they know how to prepare themselves.
So, you said you were noticing like a different outcome based off of, you didn't say these exact words, but based off of their health. So, what do you mean by that? Like, what were you seeing?
So initially, when I started noticing that outcomes were maybe not as predictable, was when I am seeing patients in clinic and working on their skin. I have so lucky to have two practices. I have a clinic out in Santa Barbara, Evolutions Medical and Day Spa, where I'm about half my time focusing on skin regeneration and aesthetic procedures. When I have a patient coming to me who is wanting to have a skin rejuvenation procedure, but maybe their hormones aren't optimized, and maybe they have nutritional deficiencies, metabolic disorders, insulin resistance, those women were not necessarily going to be able to guarantee those outcomes the way I could when somebody is optimized and healthy. And so those were the first changes that I was noticing. And so in my experience, optimizing the whole body health is what was the catalyst for making improvements in the skin. And my other practice in Agoura Hills in Los Angeles has allowed me to dive deeper into my passion for analyzing the whole body systems. And when we talk about integrative medicine, a lot of people don't really understand what that quite means. What's interesting about the ability to blend both the Western sciences with a more holistic approach allows me to give my patients that tailored care that I may not have the ability to do that in a more structured, insurance-based model. I can have more time with my patients, more time to educate them, dive deeper into what their concerns are, and whether that is looking at different labs that maybe would be more investigative. Those can take hours to go through over different visits to understand and explain what everything means. And so, what's really been fun for me is seeing the changes in my patients over the years we work together and helping them understand how their body is working, and then fine tuning whether it's hormone balance, whether it's gut health, autoimmune diseases, and skin conditions. Everything works together as a whole. So, in the conventional model, you may have body conditions that are pieced, and not everybody's working together. You see a cardiologist for one condition, you're going to see a GI doctor for another. And we don't always talk to each other. And I think that's the way that the conventional medical model is. And so I play the role as an adjunct provider, meaning I'm kind of coming in not as their primary source of uh, everything, but kind of like putting together pieces and helping where I can. So if it's a perimenopausal woman who's experiencing changes in her body that maybe was misdiagnosed, uh, and she's seeing her cardiologist for palpitations, the whole cardiac workup, but maybe it's an estrogen deficiency, and maybe she's seeing a therapist or having psychotherapy for cognitive changes, mental health changes, anxiety, depression, insomnia. And if we don't consider her whole body systems and potentially there being a hormonal imbalance, then we're missing a big component of her healthcare. So that's been very rewarding to kind of play that role where I can help women just feel like themselves again.
That's awesome. That's beautiful. Do you have a story, like a favorite story of one of your clients?
Well, lately, I've been so lucky to have such an amazing patient base. And what's interesting is when one woman starts to feel incredible, everybody else notices and they say, Something is different about you." Whether it's they've maybe lost a few pounds and they are just feeling great in their body, or their skin is glowing. And you can't really put your finger on it, but you can tell that there's a light inside that person where maybe before they were feeling hopeless. And to see those women coming back in and saying now they're version 2.0 of themselves and feeling like they have a new lease on life. It's given them the confidence to meet a new partner, to go out and find a new profession, to do the things they didn't feel like they were able to because they were starting to feel this change, whether it be difficulty focusing or concentrating at work and they didn't feel confident to take that promotion, or they were having issues with their partner where they felt detached and they weren't connected to them anymore. Those stories, I can't even think of one person in particular because I hear this all throughout my clinic day, and it's been the most rewarding type of medical care I think that anybody could receive. And the difference is that I get to really give so much more to my patients than I would be able to in any other situation. What has been a real joy is working with women one-on-one and being a part of their lives and guiding them through these hormonal transitions. My passion, I would have to say, is hormone therapy for women in midlife who are not optimized on the protocols that they were given, and knowing that things could be better. And I think that's where we still have a lot to learn in regards to women's health. Fortunately, in the last few months, we've had a surge in popularity and women interested in hormone therapy, where just 20, 25 years ago, everybody was terribly afraid. You
Yeah.
know, we had the Women's Health Initiative study that came out and caused fear amongst all women and the medical community, and we're still trying to recover from that. And so just this past few months, we had the black box warning removed from uh, hormone products, and I think that that's a great step in the right direction.
That's amazing. Yes.
But we also have to be cautious and not put all hormones in the same category. And so when we think of bioidentical hormone therapy, that's much different than what we would use for contraception. And I think there's a disconnect with how to implement each one of those modalities. But bioidentical hormone therapy is what I prescribe. And most of the time, women will come in with questions and concerns. Maybe they've heard it's safe and now they're interested, but they're not sure what questions to ask or how to take it or how to make it work for them. But they know that they're suffering from symptoms and they've heard about the constellation of symptoms, and they're not getting the type of care that they're hoping to get from their conventional primary providers. And it's not that there's a lack of want to help, but I think that when a woman is coming to a provider, she is expecting more time and she wants perhaps testing. So I get the question a lot, should I test my hormones before I start? And I think in some cases that can be really helpful. So in my practice, I do encourage women younger and younger to get tested for their hormones to see where they are at each decade in life. Because once you start to have changes in your hormones, it's hard to know what you were, where you were at baseline 5 years ago, 10 years ago, to know what's your new normal. And so I think that the interpretation of labs can be very empowering to women. And that gives you an idea of where you are in your timeline of, of life. And that change can happen at a different age for every woman.
It is different. Sometimes it's earlier, way earlier than we imagine it to be. As far as like perimenopause goes, when would you say that the shift is from like perimenopause to menopause? And
So that's a difficult timeline to calculate because we may not recognize symptoms for years, or maybe we misdiagnose those symptoms as something else. The onset of anxiety, depression, um, mood changes that are out of the ordinary, uh, weight fluctuations, changes in metabolism. I often see younger patients coming in with metabolic disorders or lipid
When
changes.
when you
And
say metabolic disorders, I'm sorry to interrupt you, but when you say metabolic disorders, what do you mean, just for our audience? What does that mean?
So when we think of our metabolism, we want to think about insulin regulation, insulin sensitivity. Uh, there's going to be shifts in how your body processes the energy you're taking in, and what had worked before maybe isn't working anymore. And so sometimes I'll get a patient coming to see me, and her primary concern was just weight gain, and she has no changes in her life, but she's struggling with raising a family, coping with the changes in and her parents. Maybe she's taking on a lot more stress than she used to. And now she doesn't put herself first. And so she's not even paying attention to the changes in her menstrual cycle. But when you're not feeling like this is your body anymore, those are early signs of hormonal fluctuations. And that's when I usually like to intervene and start doing testing. So perimenopause is kind of the new kid on the block, and we're realizing that this is a real timeline in a woman's life. And this could be a 10-year window of time before you actually enter menopause. And I think it's important for women to understand what's happening with their bodies at this time. This is a natural physiologic process that will happen to every woman if you live long enough
Willing.
to get there. And so some people will say, well, are we trying to change nature? Are we trying to disrupt what our body's normally doing? And this is the path that most women will be on. And it's not that we need to change what's happening naturally, but some women are suffering needlessly. And so it's not that hormone therapy is necessary for every woman, and every woman should have the choice to decide, is this something that I feel is right for me? But the timeline between perimenopause to menopause can be a roller coaster ride. The body is used to rhythmic peaks and troughs of estrogen, progesterone, testosterone. These are your primary sex hormones. And so if we think about the timeline of when a woman starts her menstrual period, the body relies on these continuous fluctuations that becomes just part of her monthly cycle. And it's predictable. When when a woman starts to have any period irregularities, usually 7 days greater or shorter, that would signify that there's changes in ovulation. So when you start to have anovulatory cycles, you can notice heavy bleeding, more PMS. You're going to have more symptoms that are concerning leading up to the time of menopause. So it's not like all of a sudden you stop having a period one day. This has been happening for years. Every
Yeah.
woman is born with a finite amount of eggs in her basket. And when we run out, that's when menopause occurs. But the diagnosis doesn't happen until 1 year after the cessation of your menstrual period. But that could be confusing because some women have had a hysterectomy, maybe they've had an endometrial ablation. And so, how do you quantify that in some women? So, that's where testing can be really helpful. And sometimes just giving a name to the conditions that they're experiencing by saying, yes, you are in perimenopause, that almost just takes away the anxiety of not knowing what's happening to me. And then we can start to decide, how do we want to intervene? But it is a bit of a chaotic time for the body because, again, it's not used to having all of these changes in your menstrual cycle that it relied on rhythmically for so many years. And I know I've actually become more interested lately in how estrogen and estrogen deficiency affects the brain, because I have a lot of patients who in their 40s and 50s are at the top of their professional life. They've worked so hard to achieve the status that they are at, and now they feel like their menopause has taken them out of that spotlight where they feel their strongest, and they're having issues with cognition, memory changes, they're forgetting words. And what's interesting is that the more we learn about how estrogen affects the brain, we can see this on imaging. And estrogen has a strong affinity for the prefrontal cortex and the hippocampus, which regulates memory and word finding. So you often think, like, where did I leave my keys? What? And then these are sometimes symptoms, early signs that things are starting to change. So we have to think about this as a whole body system uh, that's affected by the fluctuations, and uh, these symptoms are quite real. And I think if we think about, I think they've actually categorized there being over 100 symptoms related to menopause. And it's overwhelming because trying to tease out what actually is going on is sometimes the most challenging part when women are coming in with all of their questions and concerns.
Yeah. Wow. That's so interesting. Yeah. Um, so, Rachel, as you know, I do a lot of coaching and helping women overcome emotional struggles like anxiety, stress, overwhelm. What is something that you do for that emotional piece? How do you support them through that?
So it really depends on their situation and what they feel comfortable with. Some women, it's hard to ask for help. They'll come in and they may not openly say what's going on, but when we start doing some more investigative work, I may, if I feel like it's something that I need to reach out to uh, another practitioner to then help with appropriate counseling or therapy. I think that would be probably my go-to if I felt like she needed more talk therapy. And I think cognitive behavioral therapy, talk therapy can be so helpful. But sometimes we need to, again, go back to the integrative approach, start to look at and dissect what's going on. Is there a situation where her stress level has gotten so high that she can't cope with the daily activities of life? And in that case, I think it's so helpful to bring in your team, health coaching, life coaching, because it's kind of all comes together when you look at the holistic approach of your patients. I think in my case, many women will come to me because they're already working with a therapist, but their therapist is sending them to me as a referral, asking for help with hormone balancing. And I think that referral-based system has been just incredible to know that I have support from other practitioners that know that these patients still aren't getting completely better with the pharmaceuticals, with therapy, and then there's something missing. Like I was saying, with the body-mind connection, there's so much more to it. And we know there's a gut-brain connection because estrogen has a huge impact on the gut. We know the estrobolome is how estrogen is responding to neurotransmitters, and that can have another significant impact on mood, stability, anxiety, and depression. And that trickle down effect can disrupt families. And at this time in midlife, I think a lot of marriages start to suffer when their partners don't understand that there is this shift in their partner as they're going through this change. Men tend to not fall off a cliff quite as quickly as women do. They don't necessarily have this cutoff point where their hormones are no longer being produced. So I think that I do have couples that come to see me, and I think that it's really helpful when the male partners can be there as well to support their female partners in this transitional time of life so that they know what they can do to support them. And I think that's been a really impactful part of my career right now.
I love that. It's so true because it's really bringing, like you mentioned even earlier, bringing in all the systems, everything into play, right? Not just the nervous system, not just the hormonal system, but all of them together, just because they all work together.
Yes.
Yeah, it's awesome.
Hmm.
I love that. Okay. What is one of the best compliments you ever received?
Oh, um, I think if we're talking about this turning point in not just my life, but also the patients I worked with, when women come in and they start crying, thanking me for giving them the life back that nobody else could at that point. And to me, that's the biggest compliment as a practitioner, to be able to transform someone's life when they came in just a shell of themselves. And when they come in and the way that they look at me, it's like there's light in their eyes for the first time. And they'll say that the work that I'm doing here means so much more than just how much this has helped them. But being an advocate for women in their menopausal journey is no easy task. And the encouragement I get from them and the support has been just incredible and so fulfilling for me. So I think that's the biggest compliment. And that's what keeps me going and keeps me doing what I'm doing. And it's tireless. I mean, as a healthcare practitioner, we're always working for our patients. There isn't a time where I'm not thinking about somebody. And at the end of the day, I can sleep well knowing that I've done everything that I could in that workday and everybody's needs are met, at least for that moment, till the next day. And I know that my patients will give me grace if I take longer to respond. Sometimes there's not an emergent case, but everybody has a sense of panic when you don't know what's happening with your body. And I think that uh, when I can be that supportive person to them, that's the biggest gift that I can give. And when I hear from them how much it's impacted their life, that's just what keeps me going. So I think that's the biggest compliments I've
Biggest
received lately.
compliment. Beautiful. I love it. Wow. Yeah, it's very beautiful. What is something you wish women knew earlier?
Mm. I think I wish women knew that they had a voice,
Hmm.
and I wish they knew that they can seek help for their concerns, because so many women suffer in silence. We're always giving of ourselves, right? We're always nurturing others, taking care of others first. And women will wait until things get so bad that they feel helpless, like there's nothing else they can do. And I wish that they knew that if they sought out help early on, that they don't have to suffer. And I always say that if you choose to wait before you seek help, it's going to it's always going to be amazing once you end up finding that person, but it may take time to make the right connection with somebody. And I think that establishing relationship with a practitioner early on is going to create that partnership. So there is this connection between your practitioner and your and the patients you're working with. And so over time, you create this supportive relationship, and you really should never have to experience any pathologies of midlife and menopause if you started early in your lifetime.
Are there anything that they can do early on that helps them transition into menopause earlier? I mean,
So,
do you know what I mean? Did I
yeah,
come across right? Okay.
uh, there's a lot of question about when to initiate hormone replacement therapy. And a lot of women will want to, let's say, wait until maybe they're in menopause before they either start or maybe their practitioners let them start hormone therapy. So by starting, let's say, supportive menopausal care before you're actually in menopause, you can ease that transition into menopause and not delay it, but help the body support itself by optimizing the hormones earlier on. So I do have patients coming to see me who are in their late 30s, early 40s that are starting to have early menopausal symptoms. And I think starting to do that investigative work early can really help to ease the transition. So they may not even know that their body's going through the menopausal change. Uh, what I specialize in is a delivery system of hormone therapy called physiologic restoration, which I'm very passionate about. And there's not too many practitioners in the country that are trained in this type of delivery system. And I think it's a conversation that I like to have with my patients so they know the differences between conventional, what we call static dosing for menopause care, and rhythmic dosing. And there are some cases that I have in my practice where conventional dosing was not alleviating symptoms, and we needed to find a way to restore their levels to premenopausal state. So that is where their body was functioning the best. That's where they felt the best in their bodies. And the results have been absolutely incredible, and it's become a huge part of my practice. So I do have to um, give credit to the pioneers who have come before me, who were thought leaders in understanding that women's hormones are not a straight linear line and
Yeah.
that we have to respect the biology of women's menstrual cycles. And when we realize that women who have optimized hormones as they did when they were younger, are more protected against things like breast cancer, Alzheimer's dementia, frailty, osteoporosis, heart disease, um, obesity, insulin resistance. Those types of conditions don't have to happen to everybody. We just expect that this is signs of getting older,
Right.
but
It's
there's
really
so much you can
exciting.
do.
It's
Mhm.
such an exciting time right now for all the different options we have and the research, and I know there's more still we need to figure out, but I love this. I remember our conversations about the physiological dosing. It's so fascinating to me.
Yeah, it really makes a lot of sense in my mind.
Yeah.
Uh, but again, it's not for everybody, and so I like to give my patients the education to make those decisions for themselves. So I'm just there to kind of guide them into the right direction that they're most comfortable with. But it is a great adjunct um, to menopausal care. And I think that once we become more comfortable with how we're dosing and the fear has gone away, and I'm hoping the next generation, it won't even be a discussion. People will just understand that hormone therapy is a safe tool to restore uh, and optimize your health for most people if they're good candidates for it.
Do you see like there's some confusion around women that are older who haven't started because they were in that time period of that fear. So now they're, 60, 65, 70. Is it too late to start them on the estrogen? Because I know there's some mixed um, research or thoughts around that. What do you think?
Mhm. So I think that that question is still going to be circulating the medical community for some time until we really have concrete data on the efficacy of starting menopause hormone therapy 10 plus years after your final menstrual period. I think what we used to assume is that the body adapts to having low levels of sex hormones, but we do know that the body will compensate for the decline of estrogen and produce its own endogenous source of estrogen by way of adipose tissue. So, in the fat cells, you can aromatize testosterone to estrogen, and you end up getting a more inflammatory type of estrogen. But the body is quite smart. We can never outsmart nature. We understand that the body will always compensate for life-sustaining measures. But what we're realizing now through a lot of pioneering research is that the brain will actually create more estrogen receptors in an attempt to pull more estrogen into the brain, which is really fascinating because we didn't really understand that before. And so now we're starting to see women as they age, their body will still be searching for it. And this marker that I test for in a simple blood test is called follicle stimulating hormone, or FSH. And you probably are familiar with that in fertility world. But this number will climb exponentially over time as the brain senses that estrogen has declined. And so, if we make this correlation between follicle stimulating hormone and, say, thyroid stimulating hormone, as you know, if you have a, a TSH that's climbing, we realize that the body is saying, I don't have enough thyroid hormone. And there's no discrepancy about treating. We know thyroid is essential for life. But when we look at a climbing FSH, nobody panics. We just say, oh, it's normal. She's in menopause. But the brain is still telling us something. So whether there's this connection with inflammation in the brain and menopause, maybe we need to investigate that number a little bit more closely and think of it just as important as thyroid stimulating hormone. So when women come to see me and we're interested in learning about how the body's responding to a lack of estrogen, I'll test an FSH. And as that number climbs, I know she's entering closer into menopause. So if someone comes to me in their 60s and 70s, they've been 10 plus years without estrogen, I know that number is going to remain high. I don't consider it benign. In some cases, if women say, I'm not having hot flashes anymore, so do I still need estrogen? What's the point? And we have a nice conversation about the risks and benefits. And when there's a shared decision making about whether or not to start, I think the guidance and the guidelines say it's perfectly safe to be on hormones for the rest of your life. But if you're starting later, you may not have the same beneficial long-term effects of preventative healthcare if you had started within 10 years of menopause, meaning that the process of osteoporosis, of bone degradation, is going to speed up exponentially as soon as estrogen declines. So I can't bring that back. So we
Right.
know that we can use hormone therapy as a preventative measure. We see increases in cardiovascular disease in women. It presents differently. And when estrogen is replaced earlier on, we can prevent the stiffening of the blood vessels. We can protect the heart from calcium plaque buildup. We can keep the lipids controlled. And so if a woman is coming in her 60s and 70s and saying, is this right for me? I think we have to look at the big picture and see what net benefit can we generate if we start later.
That's a great
But
answer.
I think that most women would benefit so much from localized estrogen. So we have to consider how we're delivering our hormones. Are we giving systemic hormones or are we giving local, which means usually vaginal support? And I think we've all come to the agreement that local vaginal estrogen is safe for any age at any time in a woman's life. But I
Good.
think that those decisions you have to have the conversation and look at the big picture of that woman's health trajectory and realize that your hormones are not in isolation. You must be looking at the whole person. And I do really love working with women at that age because there's so much still to learn. And so yeah, I think that we still have a lot to learn as a healthcare community.
We do. It's a very exciting time. Thank you. I want to shift gears and
Okay.
go into um, more personal for fun here. Tell me, how would your parents describe what you're doing?
Um, I think they would say they're very proud of me as I've kind of shifted my career when I first this is actually my second career, and it's really been a beautiful experience for me to like share with my family as they see me kind of going into this new phase of my life. And so, yeah, I think it's really special to share that with my family. And my family's actually come to me more, and we've had more discussions about hormones and healthcare. And I think they're healthy debates to have because we all have our different ideas about the type of healthcare that is right for ourselves. And so it's been fun to have these open dialogues with each other, but also to kind of be a source of information or guidance. So I think that it's been like pretty fun for all of us to kind of have these you know dinner table conversations about healthcare.
That's awesome. That's fun. If you could talk to your 20-year-old self, what would you tell her?
um well, I think that when you're in your 20s, you feel like you're invincible, like nothing can harm you. But whatever you do in your 20s is going to affect your 30s. And whatever you do in your 30s is going to affect how you feel in your next decade of life. So in my 20s, I had uh, really thought about the exposures that I was encountering in my profession at that time. Some people know that before I was a healthcare practitioner, I was in the beauty industry. I worked as a hairdresser for 15 years. In my 20s, I had a lovely career and I just enjoyed what I did so much. But my uh, downfall came from the chemical exposures with all of the products that I was inhaling and had on my skin and was putting on my patients without really knowing the harms that was happening, and the body keeps score. And so when I realized how important and how fragile your health is, and my health was declining at 20 years old, in my 20s, I just felt like I couldn't keep doing this anymore. And if I wanted to have a long career, I would have to shift gears. And so I never thought that this is where I would be to this day. But that story, the reason why I'm here is because of what I went through with my health journey in my 20s. And now I look at my patients and I think about what what is their environment doing to their health? What are they exposed to? What kind of endocrine disrupting chemicals are they exposed to that's affecting their fertility, their hormones? Everything that they come to see me about, we have to look at your environment. And if we don't stop to think about what we're exposing ourselves to, this can impact your future on such a personal level. And so after realizing how important it is to prioritize health in my 20s, now looking back, I would say, things are going to change. You just don't know how they're going to change, but everything you do, it has a meaning, and this is why I'm here today.
Thank you. Thank you so much, Rachel. I learned so much from you today. I'm so grateful for all the time we had together and getting your
Thank,
message out there. So thank you for joining me.
that's my pleasure. Thank you for having me, Denise.
Of course.